Welcome, everyone. My name is Dr. Eliana Ramirez. I am the director of the CARE TA Center. We are the Crisis and Recovery Enhancement Training and Technical Assistance Center for the state of California. I am thrilled to be with all of you today and our esteemed colleagues, Ragini Lal and Angela Brand, who will be presenting on self-care and compassion fatigue. Ragini and Angela are joining us from our partner agency, NAMI California, the National Association of Mental Illness California chapter. They are truly delightful human beings who are exceptionally skilled presenters and really thought leaders in the areas around self-care and compassion fatigue and working in virtual learning environments like this. So we welcome all of you here. So we are funded by the California Department of Healthcare Services through the Mental Health Services Act, and myself and three of our colleagues here today work at the Center for Applied Research Solutions. We are very grateful for the funding and we're very grateful for the institutional support. However, what we are about to say may or may not represent either the funder or that agency, though we expect that they would agree with some of what we're about to share. 2021, it's important to talk about security in virtual learning platforms. We do not anticipate to have any challenges with security. But should there be an issue with security, we will close down this Zoom room and we would invite you to go to your email account to await further instruction. So what is CARE? We are the Crisis and Recovery Enhancement TA Center. We are funded by MHSA to support the 58 MHSA funded county behavioral health programs and the 2 cities who also receive MHSA funding across the state of California. We provide training and technical assistance regarding the crisis continuum of care and justice diversion. Our goal is to create as much support as possible to address behavioral health crises in the community so people can stay out of emergency rooms, jails, and prisons unless those spaces are absolutely essential. We are very fortunate to work with a robust collaboration of leaders in both crisis continuum of care and justice diversion. I mentioned that Ayana, Ruth, and Livia, all of us work at the Center for Applied Research Solutions. We also work with RI Recovery International. Ragini and Angela are here from the National Association of Mental Illness California chapter. We also work with C4 Innovations, the Research and Action Center at Impact Justice, and Stanford Sierra Youth and Families. We provide a variety of services to the state. If you were to go to our website, we would invite you to check out our resource library. We also have an asset map where you can go and enter your zip code and find the crisis continuum of care and justice diversion services in your county. For example, does your county have a mobile crisis unit? Do you have a warm line or crisis line or brief psychiatric stabilization unit in your community? You can find those resources on our asset map. We do a variety of virtual learning events like this event here today. And on June 16th and 17th, 2021, we're having our first inaugural conference, which is about listening, learning, and leading. Anti-racism in the crisis continuum of care. We also invite you to connect with us through social media, through our newsletter, which we send out on a quarterly basis, and to please consider entering a TA request. Perhaps you would like consultation for something regarding crisis continuum of care or justice diversion, or you'd like a training specifically for your team. You may enter a TA request on our website. So it is really exciting for me to invite Ragini and Angela into this space, and I'm going to ask them both to introduce themselves to you. But the first thing that I will share here is that I've had an opportunity to watch both Ragini and Angela present 3 webinars leading up to this moment. And some of you I know have attended those webinars. It has been really, really exciting to learn about HIPAA ethics and professional boundaries, as well as a variety of other transference and countertransference, and other topics that are related to the crisis continuum of care of justice diversion. And so today's conversation about self-care and compassion fatigue is important, not only because the work that you all do is difficult work, but also you're doing it within a protracted period of global pandemic and systemic racism and so many different major stressors that are happening that are affecting the clients that you serve, but also us as individual people. And we acknowledge that many of us are experiencing compassion fatigue and how important self-care is for all of us. So without further ado, I want to invite Ragini and Angela to introduce themselves. And thank you all so much for being here.
Good afternoon, everyone. Thank you, Eliana, for that introduction. It's so wonderful to work in this space with you all. It's always just such a positive and uplifting space. And so I think, as you noted, after this last year, we really need more of that positivity. So welcome to all of you for joining us today. My name is Angela Brand. My pronouns are she, her, and I'm with NAMI California. I lead our agency's work around strategic engagement. And we do that through advocacy, training, and community outreach. I've been in the mental health, behavioral health field for about 10 years, and I've worked a little bit on both the public and the private side with some nonprofit agencies, as well as a number of years at the state's Mental Health Services Oversight and Accountability Commission. I work today, I identify both as a peer and a parent. I'm excited to join here with my colleague, Ragini Lal. I'm going to turn it over to her for some introductions, and I'll be back in a little bit to chat a little bit about NAMI California and what we do.
Thank you, Angela. Welcome, everyone. Thank you so much for joining us today on a Monday. So my name is Ragini Lal. My pronouns are she, hers. I'm the Community Engagement Manager at NAMI California. My work actually has multiple different hats. There has been diversity and inclusion trainings. There's been family peer support specialist trainings. I've facilitated both of those. I've also been involved in a lot of the research that we have around diverse communities in NAMI California, and as well as a lot of advocacy and community engagement and diversity large events that we have at NAMI California. So my pronouns are she, hers, and I'm also identify as a peer and a family member. And so I just wanted to welcome everyone. When it comes to my background, I'm relatively young, so I don't have an extensive background like Angela does, but my work is mainly involved in direct care that I hopefully want to do in the future. I'm currently in a graduate school for mental health clinical counseling, and then eventually I'm going to go into clinical psychology. So that's just kind of where my perspective comes in. Before we kind of talk about what NAMI California is about, just today we're going to kind of go over the significance of self-care, kind of the levels of functioning, and then what effective helpers are and what that would mean in the mental health field. And then also talk about some strategies to prevent compassion fatigue. And we're going to also kind of go over compassion fatigue a little more. And then, talk about how we can build resilience using self-care as a tool and to also prevent further compassion fatigue.
For those that aren't familiar with NAMI California and what we do, NAMI is the National Alliance on Mental Illness. Our affiliates work at the state, national, and local levels. And we support family members, caregivers, parents, and those who support individuals living with a mental illness or a mental health challenge. Our particular office, NAMI California, works at the state level, covering California and our 58 local affiliates, and providing that support through policy and advocacy, training and education, and community outreach and engagement. We're incredibly fortunate to partner with the team at CARS and those at the CARE TA Center to bring you information like our session today. If you have any questions about our organization, we can drop our agency's website into the chat, and we have our contact information that'll be presented at the end of today's session for any additional information that you want. But with that, I'm going to go ahead and turn it back over to Ragini.
So today we're going to talk into self-care, and regarding self-care, we're going to talk about effective helpers and what that means in the mental health field, what compassion fatigue looks like, and what the meaning of compassion fatigue. Having proactive engagement, and that means constantly kind of thinking about and doing self-care, doing a continuous work of engaging yourself so you can prevent compassion fatigue, and then how actually that builds resiliency. So this one's a Menti. So we want to do a little interactive piece. So moving on to the first question that we're going to be asking y'all, again, you can also use chat, is what is your definition of an effective helper? So I'm saying someone who listens, acts, and is willing to learn, compassionate, with lived experience, open-ended questions that lead participants to their own solution. Yeah, helps you proactively, continuously helping you try to move forward, listening deeply, having empathy, sensitive to thoughts, feelings of others, willing to be selfless, listens to understand the situation with the intent to resolve. Really great responses. Positive problem solver, assist and promote further self-autonomy to the individual seeking assistance in everyday activities. Yeah, these are all wonderful responses. Calm, caring, dependable, selfless, empathetic, active listener. Thank you all for your responses. They're all wonderful. So yeah, I think you all have a really good idea of what an effective helper means, specifically in this field. And it's important to be an effective helper in this field and all the roles and positions that you all have. Cares about people and shared lived experience. Let's go back to the slides. Thank you all for your responses and sharing. So the features of effective helpers are, like you all said, they're warm and accessible. They care deeply about others, and they have the capacity to provide the support. And that's really important. So they have the capacity to be able to cope with problems and situations. They have the capacity to be able to be a positive influence in someone's life, and then they inspire confidence and trust within the individual that they're working with. So they're, like all you said, some of you mentioned that they're mature and care deeply about others, they're compassionate, they act to remedy injustice, they're high functioning and human. These are human beings. One person mentioned someone who has had lived experience. So having that is actually really important, because being human and being someone who's able to have that background is so important, because it actually gets you a connection with that person, with the individuals that you're working with. That, like, I actually understand exactly where you're coming from, and I'm in a place where I'm able to help you, and I can see you getting there as well. So that's the type of mindset that usually effective helpers have. Care deeply about people. You wanna be something that actually helps them, someone who actually inspires them to be able to move forward. So we're going to talk about the 5 levels of functioning. So as an effective helper, you want to really, really focus in on the 5 levels of functioning. It's kind of where you are at. One of the things that I mentioned earlier was that you have the capacity to be able to help and cope. You're at a place where you are able to effectively be there for someone and really care about them. And it comes from a level of, like, I completely understand, that I really, really listen and empathize. And I think we all strive for that all the time. I don't think it's something that we necessarily lose, because we do care. That's why we're here. That's why we do the work that we do. But sometimes our actions and our behaviors don't match. The times that your intentions could be so well, but sometimes you're just at a place in your life where your functioning might not be at level 5, which is a high level of empathy is taking place. And then sometimes some folks, when they're having hard days and hard weeks, can maybe go to level 4, level 3, where adequate or a minimum amount of empathy is taking place. And then when we get to burnout, when we talk about burnout or compassion fatigue, that's usually when you start to see level 2 and level 1. So this is just an example of empathy, but the levels of functioning could be using any other type of skill that we talk about. It could be caring, it could be listening skills as well. So level 5 would be a high level of listening, that you're actively engaging with a person, your nonverbal and verbal is there. Where level 1 is that you're just, you're like, nope, I don't want to even listen. You zone out majority of the time when you're speaking to someone who is asking for your help. So those are just kind of an example. But these are the 5 levels of functioning. So more on that. The characteristics of the 5 levels of functioning could also be respect, regard, genuineness, concreteness, and warmth. They could also be used in the same scale, but I've also used them to kind of evaluate different skills. Like one that I just talked about was listening skills that I have. A little more on that. So the helper's level of functioning is high on these important traits of facilitative conditions. Then constructive changes are more likely to take place. It's pretty obvious that we think about, like, of course, if someone's giving you a high level of empathy, then a more positive outcome is more likely to happen. Versus when someone is giving a low level of empathy, there could be some issues that might arise. It could actually deconstruct the relationship that you have with the people that you're working with. If this helper, this is kind of an important one, the third one, the third bullet point says, if the helper is on the same level as the receiver of help, then no change is likely to take place. So when we think about that, we think about some individuals may come in and they're burnt out. They're at level 1. So let's say we're going to use the empathy example. So if someone comes to you and is at level 1 of their own empathy, and if you're right there with them, there's not going to be that positive attribute where you have that inspiration and both of you are kind of burnt out. So where do you go from there? So that's also really important to think about. When we talk about levels of functioning, we talk about levels of functioning in a way where you're supposed to, or you try to at least understand yourself and kind of figure out, where am I? So some of you, when you're hearing about this, you might be thinking, I wonder where I am in the levels of functioning. Are you level 3, 4, 5, 1, 2? And then based off of that, we can talk about, and you can think about what you can do to kind of help you get to more on a level 4 or 5. I don't think, one thing I want to kind of say is that I don't think it's possible for everyone to be at level 5 all the time, all day long, all year. It's just not possible. We're human beings, we're gonna have hard days. So the levels of functioning is also very fluid, but something that we just want to remember, that we are capable of getting to the level 4 or 5. And then if we do get to a level 1 or 2, that's totally okay. You'll start to see some things where you have compassion fatigue. When you start to see the symptoms, then you'll realize that you're at a lower level than you expect to be. But that's okay, because we're supposed to learn from that, and we're supposed to understand that, okay, we're not in a good place right now. Maybe we should take a break. Maybe we should do self-care. So we'll talk about that. So going back into effective helpers. So some personal characteristics when we talk about effective helpers are, as some of you mentioned, they're altruistic and compassionate. They're motivated by deep care. They use person-first orientation. So they identify with humanity, and they are open about motives for helping, and they receive meaningful benefits from helping. So that last one, receiving meaningful benefits from helping, is so key, because I feel like when we are having compassion fatigue or at a lower level of functioning, let's say with empathy or genuineness, that meaningful benefits doesn't feel as meaningful anymore when we're at a spot that's difficult. But when we're at a higher part where we're completely altruistic and empathetic, and you're having a great time, and you feel that you're really affecting people's lives in a positive way, and you go home with a smile on your face. So those are some personal characteristics. There's a couple more on the next slide. So there's also awareness and self-values. So self-aware, ethical, and influential. This one is really key when we talk about self-care today. So the first way to even think about being an effective helper, to figure out where you're in your functioning, whether you have compassion fatigue, and where you're at on the spectrum, that first thing to have is a self-awareness, to be able to think about yourself, where you're at right now, where you were before, and where you would like to be. So self-awareness helps protect the clients from helpers inadvertently projecting their values onto the helpee. That's another way of having self-awareness. It helps identify whether or not the helper is judging the person that they're working with by a social cultural norm. And it guides helping in that it allows the helper to be aware of what he or she believes regarding human nature and change. So self-awareness beyond the self-care is also being able to make sure that when you're in the moment working with the individuals that you're working with, that you're able to really think about, like, okay, how I react really does affect this person's behavior in this moment, really affects the way that they'll think about what they'll take away from home. So it's really key to be self-aware during the times you have those interactions with the individuals you're working with. They're culturally respectful, and they're able to analyze your own feelings. And you're also responsible for yourself and actions, and it can be hard to do from time to time. It can be really difficult to recognize that, oh, maybe I said something that I shouldn't have said. And a lot of times when we talk about, let's say, culturally respectful, we tend to say something that we're comfortable with, which is, again, it's okay. And then, but then we have to realize, but then if someone says something to us that is like, oh, actually, I didn't like that. Like, I would prefer if you called me this way. Right? I would prefer if you not say that. It's triggering to me. So you want to be responsible for that. Like, oh, I'm so sorry. I will make sure from that point on that I will address whatever we're talking about in the way that makes you feel more comfortable. So you want to be responsible for yourself. You serve as a catalyst for empowerment. That's really high in the empathy level, high functioning. You're consistently trying to empower the individual and believing in themselves, and believing that they are capable of getting to a place where they're feeling comfortable and okay in their life. So let's talk about compassion fatigue. So on that slide, it says, compassion fatigue is a state experienced by those helping people or animals in distress. It is an extreme state of tension and preoccupation with the suffering of those being helped, to the degree that it can create a secondary traumatic stress for the helper. It's by Dr. Charles Figley. So Charles Figley is a university professor in the field of psychology and family therapy and psychoneuroimmunologist, family studies, social work, traumatology, and mental health. He was a distinguished chair in disaster mental health and graduate school social work professor at Tulane University. And so he's done a lot of studies regarding trauma and mental health and social work. And when he talked about secondary traumatic stress, he talked about how it's the emotional duress that results when an individual hears about the first-hand trauma experiences of another. Its symptoms mimic those of post-traumatic stress disorder. So secondary traumatic stress can happen when, of course, it can happen to all of us working in a field where, we're in a place where we're constantly hearing the hardships that people are going through, how they feel. And you can easily, when you're empathetic, you can easily understand how they're feeling, and that can also reflect back on how you feel. I also have a hard time going home and not, when I've had sessions with crisis counseling that I've done before, where I've gone home and thought about like the person that I was talking to on the phone, and then I felt that pain that they were going through. And then if you do that on a daily basis, and then you start to kind of get desensitized to it almost, especially if you're in the crisis continuum of care, and then you start to feel the compassion fatigue. And then compassion fatigue is more of an extreme side of just feeling secondary traumatic stress. It's on this extreme side where you're feeling that you're helpless yourself, where you feel that you're too stressed to even think about trying to help others. So here are some symptoms of compassion fatigue: loss of purpose, anxiety, sleep disturbance, hypervigilancy, feeling overwhelmed, poor self-care. Maybe you were doing self-care before, and you were very active on that for quite some time because you knew, and maybe entering this field, that this can cause high compassion fatigue. Maybe it got to the point where you started not being able to do all the things that you need to feel that you're at a level of functioning that you can help others. There's an inability to concentrate, withdrawal, isolation, anger, and self-doubt. So a lot of these are, I feel like, commonly experienced, and pretty much everyone who's worked in the almost everyone who's worked in the mental health and behavioral health field. We feel all of these things to a certain degree. Maybe we feel self-doubt after a while. I know individuals who may also have some type of feelings of imposter syndrome, where you start to feel that you're not actually helping them, and that maybe your clients can see right through you. I know some therapists have had that. There's been studies on that. And then like feeling overwhelmed. That's one of the most common symptoms I've seen, where everyone is just overwhelmed by the amount of work, the amount of times you have to sit there and just be on. Being on is exhausting. Not being who you are all the time outside of work because you have to be a certain way, present a certain way to someone that isn't in need of your help. It could be exhausting. So those are some symptoms of compassion fatigue. So what do we do when we feel that compassion fatigue, when you're seeing those symptoms in yourself? We want to talk about personal resilience. So building that resiliency, which is I feel easier said than done. So there's awareness of personal limits, emotions, and resources. So these are some ways that we can build personal resilience. There's maintaining balance in personal and professional. So compartmentalizing your personal and professional life, which is harder said than done, because as someone who's studying clinical counseling, I constantly apply what I study into my life, into my relationships. So it's a lot harder said than done. When you care so much about human beings in general, you don't just care about the people you're working with, you also care about the ones that you know on a personal level. So you want to try to maintain a balance. Connection to your inner self, community, and spirituality. So if someone so having those connections is highly important to other individuals, to people that you feel safe around. It could be in a whole community. It can feel like that you belong to something higher than yourself. That doesn't mean that you have to be spiritual or faithful. It could just be, like me personally, I just like to feel that I belong in a place where I'm able to help others, and that makes me feel good. Connection to your inner self usually means just being able to really being present with yourself and your emotions, kind of where you're going through right now, and what your needs are, what you would like to be, what you want to accomplish. So those are some type of connections. Connections to your faith is also really important as well. Acknowledgement of pain of self and others. So don't be afraid to be able to say, you know what, I am not doing good right now. I am very, very sad. And I don't think I can help others who are doing very sad, or also being, very sad. And then also acknowledge that those people aren't feeling well. Are you able to give them a space, a relationship with them where they're able to be able to get out of that, to be able to move forward from it. So you want to be able to acknowledge that, that's a good way to build empathy again. If you're feeling like you're not as empathetic, is to be able to try to understand what others are going through. Again, which is a lot harder than done, or a lot easier said than done, because when you're at a point where you're just not feeling it, you need time to yourself, you don't want to think about caring about other people, it could be hard, but it's a great way to build that resilience. Reduction of isolation. Try not to isolate ourselves. I feel like I think that's really important in its connection, how it's connecting to your community. I think it's really important for a reduction of isolation as in a way to make sure that you're connected to your community. I'm personally an introvert, and I'm someone who actually needs time alone. So I'm someone who needs to, if I need to decompress, I don't want to be around people, because when I'm around others, I care. Like even the people that want to be there for me, I just want to talk about them. So for me, isolation is somewhat important, but not to the point where you're completely isolated from your community, that you're not seeing the people that, that care about you, that you love, and you're just completely removing yourself. You're putting yourself in a higher risk of compassion fatigue. So of course, I would say definitely take time for your own needs, to be by yourself, to do, and sometimes for people, self-care is, having some few hours or maybe a day or two or a weekend to just kind of decompress. But also reduction of isolation, I would say not to isolate yourself completely, as in remove your relationships from your lives and your community. Increasing validation and hope can be also very difficult, but it's also, self-care tools are really important in using that, and to be able to increase validation and hope. It's good to be around folks who care about you, because they will be putting validation towards you. They will be able to say, you know what, it's okay, you're a human being, like it's totally normal that you feel this way. And then when you're around a community, around people who are validating you, you'll also kind of sometimes will naturally start to feel hope. Building hope is harder said than done, as you all probably know, working with others. And when you're in a place of compassion fatigue, and if you're someone who also may have some mental illnesses such as depression, and you're a peer yourself, building hope is sometimes one of the harder things to do. It's really important to be able to put that into yourself so that you're able to build personal resilience. I think hope is something that we talk about often with others, that we kind of try to get them to have hope in themselves and in their future and their lives. But we're preaching that so much that we forget to kind of follow that ourselves. So maybe using the same skills that you use to kind of help others build hope, to also put those into practice into yourself as well.
So the first question is from Sandra Gomez, who asks for an example of minimization.
So minimization to me, and Angela or Ileana, correct me if I'm wrong, but minimization to me is when you start to kind of value things less. To me, that's when minimization, because you're just kind of minimizing kind of everything that's like positive, or you're keeping things kind of short, and like in a way that's like, I'm not saying that I have compassion fatigue, but I would like to use this as an example of earlier, since we're in the moment together, all of us, where I talked about how I don't have a lot of experience in my life, when it comes to behavioral health, and I'm just minimizing my value. I'm just saying like, oh, it's not even that big of a deal. What I do is not that big of a deal. That's kind of, you're constantly putting yourself down. That's what I think minimization is, or what I got out of it. Ileana, do you have any other examples of that?
I think that's such an excellent example. And when I think about the crisis continuum of care, maybe one of the things that we minimize is if somebody, especially a young person, discloses they're having thoughts of self-harm, we might say, oh, they're just trying to get attention. So we're minimizing the severity of the discomfort that they're in. And it can be a way to protect ourselves, because it's scary sometimes to sit with someone who is so upset that they want to end their lives. You did a great job with that question, Ragini. Thank you. We have one more. Rosalias Reed asks, what are some ways we can help our fellow team members if we see signs of compassion fatigue? What a lovely question.
So our team members, if we see signs of compassion fatigue, that's actually a really great question. We talk about it in these slides in a way where we're talking about ourselves, but what if you see someone else having compassion fatigue? That's really important. I would say at those times, some ways that you can do is just ask them if they're, check in with them. How are you doing, really? Like, we constantly talk about it in a professional life that we're supposed to keep each other accountable, but we should also try to keep each other safe and feeling like they're okay. I'm blessed enough in my team where I'm consistently having check-ins with folks, and we talk about how not only just talking about work, but just checking in with them, like, hey, like, I'm sensing that you're not smiling as much lately, but I mean, maybe not that one, because sometimes I don't smile on days, but that's just because I have nothing to smile about. but maybe just like noticing that you're noticing something that's really important to them. Maybe they were someone who really were maybe it was an individual who really wanted to be in all the team meetings and was super excited about it, and then you're starting to see that they're kind of isolating themselves, that you see a symptom of compassion fatigue. So my biggest thing is always just checking in with them. Hey, how are you? Are you okay? Let's have lunch. We want to have lunch together. And then just kind of being there, listening to them. Sometimes when I have spoken with my coworkers, I listen to them and I'm like, you know what, I can totally relate. And by the end of the conversation, they're like, wow, thank God I'm not the only person who felt this way. Because you work in the same environment, you're going to have commonalities with the individuals that you work with your work environment. So it's good to just check in with them. Don't ever be afraid to ask how they are. Even if you feel like you don't know them personally, it's a great way to get to know someone. It's a great way to really check in and build that bond with your coworker, and then being there and actively listening, and then also being able to maybe find a place where you can bond and relate to, and let them know that, hey, maybe we work in different departments, or hey, we might not be that close outside of work, but just know that I can be your work friend. I think it's very, very important at work to always have someone that you can speak to, not just about work and, of course, in your professional boundaries, vent about work, but I think it's a really great way to be there. So I think the ways that you can do is just be able to have lunch with them, not make them feel so alone.
Yes, what you're saying is resonating so strongly with so many people. We have one more question, and I'll leave it to you. I don't know if this is something that you would want to address now or later, but the question from Lisa is an outstanding question. Lisa asks, if you start to feel overwhelmed and want to take a break, how can I do that if so many people want me to always be there for them? I don't want to let them down.
That's a really, really good question. That's how I feel a lot, all the time. I completely understand, Lisa. And I think that's something that we all go through. Again, we're here because we want to care about them. We not just in our professional lives, but in our personal lives as well. So that's where self-care tools are so important. And we're going to kind of go more into it. I would say, even though you might have, maybe you already have some self-care tools under your belt, kind of ready to go. Sometimes for me, it's finding the right self-care tool at the time, because when you always have a lot of people who want a lot of help, my biggest thing, and it was super hard for me to do this, and it's still taking me time to do this, is setting boundaries and limitations to how much I can provide help. That's always the biggest one, because, and I'm not going to say it's easy at all. It's not for me. Just as you, Lisa, I care very much about the people that are around that really, really need my help or rely on me a lot. I mean, even adults, my own parents, they need me to write an email and stuff. So there are times I really have to practice saying, like, I can't right now, or maybe later, or sometimes just even saying like no, asking someone else and stuff. And sometimes it's harder to do that because you might not have someone else to help direct them or help them, and they might solely rely on you, only trust you. And I know there's situations like that. It gets very difficult. But my biggest thing would be just being able to really practice. I would say start practicing building boundaries and limitations. And you can start in small ways, such as, if someone asks you like something super small. So if someone, let's say if you're living with someone asks you, can you go get water? It's like, can you get that yourself? And stuff. I know that's a really awkward, type of example, but I had to start that way. I had to be like, I just sat down, maybe not right now and stuff. And it's not that I don't want to give them water or anything like that. It's not that you don't stop caring. It's just that it's just me practicing. And I'll be completely honest with my loved ones that like, hey, I just need to start building boundaries and limitations, not because I don't love you or care about you, but because I need to learn how to say no. And I think that's a great place to start. Angela and Liana, do you have anything else with that?
No, I think those were all really great examples and answers to those questions. So I would just chime in and agree that I think this is something that resonates with a lot of us right now, personally, professionally. Just, we've had a really long year and we're finding ourselves stretched really thin. And for a long time, the conversation around compassion fatigue specifically was, kind of a workspace thing. And we really thought about focusing in, the professional environments that we were working in. But I think if anything, over the last year, we've really learned that, we're experiencing that for our families and our kids and our parents and our neighbors and our best friends. And there's so much right now that we're feeling pulled in a lot of different directions. So, the things that are being shared, I think is really common for a lot of us. So
as I was kind of been mentioning throughout the slides, a key thing to be able to understand your own compassion fatigue and your own, levels of functioning is to know yourself, to be self-aware. So pay attention to your personal early warning system. Not only when you're going through a time where you're kind of pushed past your early warning system, you might get to a place where you reach higher compassion fatigue. And it's not just you that is feeling that way, but all the people around you as well. They can see that you're not at your best, and so your early warning system can easily look like something like feeling tired that day. And I feel like that's something, as Angela said, we feel all the time. I'm very tired of being home, so, and it could be something as simple as maybe skipping your vitamins for the day, and just something small. So your early warning system so you should be able to recognize your early warning system is to be able to recognize what you do commonly and on a daily that matter to you. And I feel like those are some times that we start to recognize, oh, okay, I skipped this, maybe skipped breakfast. Maybe you've been doing that a few times a week now and you love breakfast. And maybe you're starting to see that you're forgetting things here and there. That's a little higher in the compassion fatigue. But even then, it's good to know what your early warning system may look like. So, and it's really important to recognize it so that you prevent further compassion fatigue and further issues as you move past and move on in your life and you go day to day. Because higher levels of functioning can easily look like, as we talked about, the symptoms of, you can reach a point of anxiety and depression. You may not want to be able to get out of bed. You might skip meals. You might feel overwhelmed. You get angry when you're in relationships, when you're living with people, especially right now, when you're always around the people that you live with. It can get really stressful because, you can only see the same people so much every day and for so long. So not that you don't love any less, but it gets exhausting. And then you start to have angry conversations. You start to have a lot of tension and stress. And then that could, that can go into your professional life, that can go into your own personal self-care. So it's good to know early on, okay, what is going to help me. For me, I noticed that I haven't been taking vitamins in the morning, and I'm like, okay, that's important to me, and I need to make that important to me. So just recognize something small that you do that you might not be doing anymore, or that you're doing that you haven't done before. Cutting your nails, people have habits that they do. Your body responds heavily to stress, so really, really pay attention to your own body as well. So professional and personal prevention, this is really important in the field that we work in. You want to be your own first responder. That means you want to be able to really, like I said, recognize your early warning systems, I would say for me, I had to list down coping skills that I have in moments that I would have activating feelings, or that I would feel really tired. So you want to be able to just quickly be like, oh, okay, I recognize that. Oh, I need to do something about it. So you being your first responder, immediately reacting to preventing whatever you're feeling at the moment or whatever you're thinking at the moment, and kind of stop it from getting further and deeper into a more negative space. You want to acknowledge the trauma. You want to acknowledge the trauma of others. You want to acknowledge the trauma of yourself. Do validate yourself. It is okay to feel and think the way things that you do. You want to maintain normal schedules. Like I said, it could be that you eat breakfast in the morning. Definitely keep maintaining that. Stick to the things that help you in the morning. Maybe do it later on at night. Maintaining whatever your normal schedules are. You want to, again, separate your professional and from personal life, which is harder said than done in the field that we work in, because we care, and we care in both our professional and personal lives, but you want to keep that separate. So something like that could look like when you're driving home from, if any of you are therapists, or if any of you are peer specialists, when you're driving home from having a couple meetings all day with clients and you're thinking about them, you want to be able to stop that. And like I said, it's very hard to do, but you want to be able to stop that, direct your attention to maybe music or something else. For me, it's hard to do. So I call someone, like I call a friend, and I start talking to them about, other things, so I can just go from not thinking about work to talking about something else other than my work. So I try to keep that separate. Those are some strategies that I do. But You want to pay attention to your basic self-care. So this is kind of what I was talking about before, but you want to pay attention to something that you do that's really important to you and then actually helps you. And then you want to continue doing that. You want to continue to your basic self-care. Getting up in the morning and brushing your teeth, taking a shower. Those are basic self-cares. Being able to take care, maintain, your physical self and your mental self. And that can include, like, for some people, folks, it might be reading the newspaper in the morning. For me, sometimes I like to go online to my social media, and I just something I do for 5 minutes just to kind of feel like I'm connected to the world with its limits, of course. And then guarding against numbing with excess. So that desensitization that we're feeling is really high on the compassion fatigue symptoms, and you want to be able to prevent that from happening where you are desensitizing yourself. So as we mentioned before, continuously trying to acknowledge other people's pain and trauma, building and continuously validating and understanding someone else's experiences and challenges. You can get to a point where you're just like, I think Eliana just gave a great example about self-harm and a teen. And then when we minimize it, we kind of start to like desensitize it in our head where we're just like, oh, okay, I've heard many teams talk about this a lot, and it seems like it's a common thing. Yeah, it may be a common thing, but to that person, it's the first time or several times that's happening in their life. So you want to be able to prevent yourself from being able to get overly desensitized. Of course, as professionals, we have to maintain our professional, composure, or be able to help others in a way where you're at the moment working with them, and also being able to provide coping skills for yourself. So sometimes that can blur the line and become at a point where you start to feel numb from hearing what the things that people are telling you. So a good way to prevent that is to be able to still just genuinely care and like listen to them at the moment, and not just relate whatever you're hearing at the moment with something else and minimize it. So it's just something I talked about, minimizing traumatic stimuli and news and social media. So this is something that you don't want to minimize the person that you're working with, but you also want to try to step away from things that might cause any retriggering, any news on social media that could lately it's been really difficult in the US, especially. The news on social media have been really hard. As someone who identifies as a high empath, last year I was avoiding going on any type of news for a couple months, because I would get really sad, like to the point where I would cry, just watching others go through the things that we're going through in the social justice field. And so you want to try to minimize that. Of course, keep yourself informed, but sometimes we get to a point where we get so involved in everything, again, because you care, there's nothing wrong with it. But sometimes we get to a point where we get so involved in the news and anything tragic that's happening in the world that it starts to really affect us, and we kind of bring it home and keep it really close to our hearts, and it could be hard. Know your red flags. Red flags could be anything that would cause any type of re-traumatization, secondary traumatic stress symptoms, and any activated feelings. And then using the RAP plan is really important. So so the Wellness Recovery Action Plan is actually a really great tool to use when you are feeling any type of compassion fatigue. It's a good way to just check in with yourself and also figure out kind of where you're at the moment. I think we put it in one of our previous sessions before, but I would be happy to find it again, and maybe in the follow-up email, we can kind of add it in. And then you want to be able to debrief with colleagues. So that's super important too. That's something that we kind of talked about the last couple of slides, is to be able to have someone to check in with, especially maybe those who are working the same related field. If you're a social worker, being able to talk to a social worker, being able to talk to your supervisors. And if you don't feel comfortable talking to your supervisor and venting, having that work friend is really, really important. Maybe not exactly at your job, but just maybe someone that you're connected to. I have several NAMI affiliate staff members from different NAMI affiliates that we have that I have really good friendships with and I check in with all the time, because even though they're not from NAMI California, we relate a lot to the work that we do and we talk about it. So seek appropriate help if needed. And again, if you're getting to a point where you feel like you're having symptoms of any type of mental conditions yourself, then definitely seek appropriate help. I strongly believe that therapists should also go to therapists. I actually heard something really important, and I didn't even think about it this way, that therapists aren't just there to help you figure things out or help you, work towards, the struggles and challenges that you're going through. But sometimes this one therapist at UC Davis in one of the conventions that I went to said that you can still go to therapists to just talk about things, even if you're doing okay in your life. So having that support, they're there for as a support. So that support could just be someone that you professionally talk to about your life if you feel like you may not have that. So definitely seek appropriate help if needed, not just when you're not feeling so well, but also at times to just check in. And then consider speaking with a professional, which is what I just. So of course, what we've been talking about this whole time is about how to take care of ourselves. So the important piece of this slide is take care of yourself first. I think, a great example that we talk about is about if anyone's flown, I'm not sure if everyone's flown, but if anyone's flown on an airplane, you hear the flight attendant tell you pretty much every flight that you should, when the air mask drops on the flight, if there's any emergencies that happen on a flight, what happens if the air masks drop down? And then they even tell mothers specifically and people, and then everyone that you put on your mask first before you even put it on your kid or before you put it on someone, that's next to you. Then you assist passengers after you put on the mask first. And that's such a great analogy of, if you can't breathe, how are you going to help someone else breathe? And so that's basically kind of the way that we're talking about when we talk about self-care and taking care of yourself. You want to be able to put on your mask first and be able to breathe and be able to feel and live and care and empathize and have all the skills that you need to be able to be an effective helper in this field. And then so it's really important that we keep that in mind, that even though we're here to help others and we want to empathize, that we should definitely be feeling welcome to empathize with ourselves, to be genuine to ourselves, to take care of our own needs, to love ourselves. All of those things are never easy, but they are so important in the work that we do. In the crisis continuum care, especially, it can be really hard to have the follow-up, to hear all the stories that we hear and then think that we have this idea where like, oh, this person is going through it worse, I shouldn't be worrying about myself. Well, I mean, okay, there may be something, but that's their life. Your life is important too. Your life is important to them because you're their help. I think it's really, really important that we take care of ourselves first and just really find ways that we can think about what helps us breathe, helps us not just survive, but thrive. I always like to I like to live life in a way where I'm thriving, not just surviving. You're a really valuable person in doing the work that you do. There are ways to prevent burnout and to prevent compassion fatigue. So the question actually is, if your personal self-care practice was equivalent to driving with a tank of gas, and this is only if you're comfortable sharing, you don't have to, you can also share on chat. Are you currently running on empty, half tank, or full tank? So that's a great way to kind of quickly check in with yourself. I like to do this. One of my self-care strategies is, and to build more self-awareness, is to do this sometimes on a daily to a weekly basis, where I kind of check in with myself on the beginning of the week, the middle of the week, and the end of the week. Like, where am I feeling? What do I do about it? Oh, okay, looks like everyone is responding. And then the second question, the follow-up question to this is, how self-care different in each? Some people are responding empty, half tank, almost but not half tank, currently have no tank. Yeah, I mean, yeah, okay, so that's really high on the compassion fatigue, not even having a tank. Your engine's just burnt out. So a lot of folks I'm seeing are kind of going in a half tank right now, and then some are on empty, and some don't even have a tank. So when you think about that, when you think about where you're at and how much gas you have, or even if you have a tank, how would self-care look differently in each? It could be about yourself or just a generalized. So how would self-care look differently for those folks who are in empty, half, or full tank? Also, for those folks who are completely empty or no tank, I really hope that you are able to speak with someone and able to have someone to that could listen and help you, because I know that that's so difficult. I'm not trying to call you out or anything like that. Even though folks are on half tank, I know that's a really difficult spot to be in right now. It's really, really difficult. And also I want to really, really acknowledge that for answering honestly, because I would have had a hard time saying that, yeah, I'm at an empty tank. And if you feel that you don't have someone to talk to, please feel free to give NAMI California a call. We have a lot of support groups that are offered throughout California, through all our different NAMI affiliates, so that you are able to, maybe it's always nice to just be able to talk to people. I don't see any responses on the second question, where how would self-care look different in each. For empty, I would say, like I said, speaking with someone, getting the help, not isolating yourself, really important. It's, and I've been in times where I've been empty in my life, but I just keep pushing through, and it's actually has not done it hasn't been the best strategy. I highly don't recommend doing that. Do take that time, even if it's one day or a couple hours, to just out of your whole week, which it feels like it's impossible, even if you have to get up a little early to do some type of self-care strategy or tool. Just even like going online and speaking to someone. There's a lot of like warm lines you can talk to, just anything that could really help you get to a point where you are able to at least go to a half tank. And I think for the folks who are a half tank, that's kind of, you're in a teeter-totter spot where you were at a full tank maybe, but then you feel like you're not as much of an effective helper as you were before. So what can you do to not get to empty? So this is some things to think about. And when you're at full tank, that's great, amazing. Keep doing what you're doing, and that's good. How can you help others? Just some questions to think about. We can go on and move on to the next mentee. So I like this question a lot, because I like to ask everyone what works for your self-care, if you have any self-care strategies. And then if you do have self-care strategies, how can you improve? Let's say based off the last question that we asked about where you are in your gas tank. I can start off and give you an example as well while people are answering. One of my most important self-care, as I talked about, is actually having some time to decompress to myself. I learned that I can't help but when I'm around others, constantly want to think about them and not think about myself, and ask them questions and talk about them. And then I kind of get tired from that. So I need time to take care of myself. How I can improve would probably be doing something proactive while I'm taking time for myself, not just sitting there and thinking, but maybe doing things like painting and things. I dance from time to time, but I feel like those are ways I can improve my self-care. That's just an example. So self-care looks like a long dog walks, hiking, reading, by looking for mental health resources or groups to speak with the same field, taking a bubble bath and reading. Self-care, selfish, saying no, declining invitations. Yes, I love the declining invitations, yes. Not feeling obligated to say yes or attend all the time. Socializing with friends. Like to work out, spend time with family, listen to music, walking with your dogs. Do a bit more often. If something working, change it. I really like that part. If something's not working, change it. I think what we try to do is we stick to what we are used to and we stick to it, but it's not really working anymore, or maybe it's just not, it hasn't worked this whole time. Then don't be afraid to definitely take other steps, other solutions that could work for you. So I really like that you wrote that. Box, mixed media journal. Bad about finding the time to do those things. Yeah. I have a giant, you can't see because I have a blurry background. I have a really giant canvas, and I even went ahead and bought painting. I had bought acrylic paint, I bought brushes. I'm like, okay, I'm gonna start painting, and then it's still sitting there empty. So I get that. So something that I talk about with time management is that I sometimes need to even like schedule time for myself, which sounds odd, but when you have a busy life, and I'm sure all of you do, or just even if it's not busy, maybe it just is a overwhelming life. And I've heard some folks that I know say this, that they've been living a mundane life lately. It's not as exciting. And that can actually cause but it can actually help make you feel compassion fatigue when you just don't feel that you are thriving, or you're not having that much excitement or more positive things in your life. So adding time for yourself is really important, and adding time for some excitement is really important. A lot of self-care looks like it's very calming. All of you are listening to music, walking on a beach, walking with your dog. For me, I like to switch it up. I personally like to get out of I keep my routine as much as I can, but then I'll take a day to do something that's different for me, so that for me personally, that I feel like I'm doing something more exciting. And I've been doing that recently, specifically because of the pandemic and the lockdown, because being at home all day, looking at screens all day can be like so exhausting. It can be so exhausting. It's interesting because in my life, my partner comes home, he works in a facility. So he comes home and he just wants to watch TV. And I'm like, no, no more, you know? So I have to think about doing different things like that. Going outside, getting sunlight. Yes, definitely. There's been lots of studies that when human beings are out, actually, if you ever get the chance, if you're comfortable with this, being out in nature is so important to our bodies. And I highly recommend this if anyone wants to try it. When you go to the park, when you're walking with your dog, if you find a place of grass, and if you, this doesn't make you feel icky or anything, but if you feel like doing it, take off your shoes and let your feet feel the ground. Let your feet feel the grass. That fresh grass feeling is sometimes really nice for some folks. Make a date with yourself, yes. Calligraphy, phone off, yes. Or change of family, agency, and community. Reading the book, 5 Languages of Love. Morning meditations. Learning how to say no without feeling guilty, yes. Yes, the sand, yep, that's my favorite one. I love the beach, definitely. So just being able to let your body just kind of be in a moment and present. I do this thing, and it's funny because my puppy does the same thing too. We'll just sit there in the park, and we'll let my hands touch the grass, my feet, take off my shoes, and I just kind of look up in the sun and let the sun just kind of soak in my skin. And that moment feels just so refreshing. Be kinder to yourself regarding workload. I really, really like that. Yeah, definitely. Please definitely validate yourself, empathize with yourself. I feel like we think about empathy, we think about just how we, care and understand other folks, but we also want to be able to empathize with ourselves, using all your senses. Yeah. Volunteering. Yeah. Helping others. That's definitely a form of self-care. So we're kind of towards at the end. I was hoping I didn't take too much time, but these are just some references and resources. I know they're going to be sending the slide, but I also wanted to, if Ayana, if you could quickly, I'm just going to go over these 2 links that we want to provide to you. And then also, I think it's like a few handouts, I would say and they're all regarding self-care and compassion fatigue.
I have the compassion fatigue up on the screen, just in case anyone wants to see.
So that's a compassion fatigue link. It's compassion fatigue awareness, and it's at compassionfatigue.org. So you can learn more about what it is. And then when you scroll down more, there's webinars and like articles that could maybe help you kind of think about how to prevent compassion fatigue. I think there's also a TED Talk at the bottom as well, if you ever want to check it out. And then I think the other link is Active Minds in Self-Care and Mental Health. And it has a lot of examples of self-care, types of strategies that you can use. And then there's a self-care recommendation from Each Mind Matter as well, toolkit. You can always use that as well. So some of the handouts that we are wanting to give you is risk and resilience self-assessment. So this is a good place to, this is a good kind of little handout. I would recommend doing it, especially for the folks who are, at half or empty, kind of knowing what your risk and if you're experiencing any of the vicarious traumatization or compassion fatigue. And it's kind of like a yes or no kind of questionnaire. And then another one is a self-care assessment. It's also a worksheet, and then it's like rating and kind of seeing like which ones you like to do. And then and think about any self-care strategies that you can implement. And then we also have a little handout called Self-Care Saturday. And just like these are like colorful kind of sheets that just kind of have a lot of like pictures and like little like recommendations on self-care. And then we have studies, 2 articles. There's Burnout in Social Workers, Treating Children as Related to Demographic Characteristics, Work Environment, and Social Support. It's a study about social workers and burnout. And then the other one is also I'm So Stressed, a longitudinal model of stress, burnout, and engagement among social workers in child welfare settings. So those are 2 studies if you are more curious about what burnout looks like in behavioral health workers. So those are just some resources and references we wanted to add. Ayana's adding them in right now. So then if you have any questions, I just want to thank you all for being here and joining me and talking about self-care. It's one of my most favorite things to talk about because I feel like it's always so positive, and I always get to really hear about such cool ideas that everyone has about self-care. And if you have any questions or anything you want to talk about, or and like I said, if you want any other resources that we can provide from the Northern California end, there are emails and numbers.
I would like to, on behalf of the CARE TA Center, thank you so much, Ragini. This was an excellent presentation. Thank you also to everyone who was participating in the Mentimeter polls and in the chat box. This has been outstanding to have this level of engagement from the audience. We really want to acknowledge that these are hard times. These are hard times for all of us. And there have been some recent studies that have been coming out talking about behavioral health providers and medical providers experiencing really high levels of stress and even compassion fatigue. So we know that part of it also, in addition to self-care, is needing to engage in work that affects our work environment. You all are frontline workers. You're necessary, essential workers because you're addressing the behavioral health needs of the community. And so whether you work at a county behavioral health department or you're working at a community-based organization, a recovery-oriented organization, wherever you might be, we are so grateful to you. If you have colleagues who are unable to attend, there will be a recording of this, which will be posted onto our website. We have additional trainings that are coming up tomorrow. In fact, we're screening the documentary film, The S Word. If you haven't seen this, we really encourage you to join us. It is a very powerful documentary. It actually received a SAMHSA Voice Award, talking about the experience of suicide, suicide prevention, suicide postvention, and advocacy that we all can be engaged in, regardless of our position within behavioral health. So again, we appreciate you attending, and there will be a follow-up email. We invite you to give us some feedback. These sessions are provided at no cost, and it's really, really important to receive feedback from the audience to know what worked well and what we can improve. And it's an important part of our reporting back to our funders as well. And please stay in touch with us. Visit us on our website. Request our newsletter, connect with us via social media, and you're also always welcome to send us an email, give us a ring on the phone, and please do submit a TA request. We would love to be able to support the really important work that you are doing in the field. Without further ado, thank you to everyone. We hope you have a most wonderful day.